Welcome back to the CPR series, part 4, AED, Automated External Defibrillator. And if you recall the systematic approach, we basically ended with CPR. Well, step 7 here, if available, we would use the Automated External Defibrillator, okay? What is that? Well, a lot of public places, including schools, the mall, even policemen are carrying these AEDs, okay? It looks something like this. And the first thing you're going to need to do with the AED is turn it on so you can listen to the voice prompts. It tells you what to do.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Apply pads. Plug in connector.
I'm going to shut it off so you can hear me. I've turned it on. It told me apply pads to patient's bare chest. Well, what do I do with the AED? Do I put it at the top of the head, at the feet? You're going to put it on the same side as you are, okay? The operator. I'm on the right side of the victim in this case. I'm going to put it just above his shoulder next to his head. If I was on the left side, the side closest to you guys, it will go right there. I don't want to have to reach across to operate the AED, okay? But if I was on that side of him, it would go there, just above the shoulder, next to his head. However, I'm on this side, so you're not going to be able to see the AED. You should be able to hear it. I've turned it on. It said apply pads to patient's bare chest. Understand, maybe you are going to need some trauma shears in order to cut a t-shirt and a blouse, like in my case, to get to the bare skin versus trying to bunch everything up or unbuttoning it. We highly recommend the trauma shears in the case with the AED. Okay?
Lloyd, ambulance 412, heading 10
The pads are going to come in a little package, kind of like a Band-Aid. It'll be the toughest thing you do, opening up the pads, okay? And it said apply the pads to patient's bare chest. So where do I put them? Well, the good thing is the pads have pictures and show you where they go. This one shows you it goes upper right on the bare chest. This pad shows you it goes lower left on the bare chest. And I'll show you exactly where, okay? So this is the upper right. This is the lower left. The right side of the victim, his right ear, his right arm, is always going to be the right side. Here, this pad went lower left. This is his left shoulder. Couple inches under the armpit is where we would put the left pad, okay? This would be incorrect, okay? Understand it goes on the lower left, a couple inches under the armpit. And then it said plug in pads connector. It's only gonna go in one way, okay? So, that's the A part. Automated. It tells you what to do. The E is external. The pads go on the outside of the body. There are some AIDs, automated internal defibrillators, okay? For people that might need that with their heart condition. A, automated, E, external, D, defibrillator. Well, what's that? What do you mean defibrillator, Fireman Tony? Well, right now we all have organized electrical activity going on in our bodies. Our heart's going to beat as normal as it is right now. Boom, 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 boom. If the heart goes into fibrillation, unorganized electrical activity, the heart's quivering as so, okay? And we need to stop that, and that's what this AED is designed to do, okay? So, with that being said, the heart goes into fibrillation, the AED will recognize that and provide a shock to defib, to stop that unorganized electrical activity, okay? We either have organized electrical activity or we don't, or our electrical activity has ceased. Many old folks When they die, their electrical activity has ceased, okay? And the AED will not shock a heart that has no electrical activity, okay? It won't recognize it. It'll tell you to check airway, check breathing, and do CPR if needed. So, what's the first thing we do with the AED? Turn it on.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Get the pads
Apply
out,
pads. Plug in connector.
put them on, and I plug it in.
Analyzing heart rhythm. Do not touch the patient.
Now, it's analyzing, so we have ceased CPR. We're not giving breaths, we're not doing compressions, we're letting the AED
Press
analyze.
pads firmly to patient's bare chest.
It prompted me to press pads firmly. Maybe we have a poor connection. So I follow that voice prompt. I'm pushing on these pads, making sure they have a good connection. Again, we're not doing CPR.
Analyzing heart rhythm. Do not touch the patient.
It's analyzing. I need to remind everybody, nobody touch them. It's analyzing.
Analyzing heart rhythm. Do not touch the patient.
It's still analyzing. Nobody touch them. That means no CPR.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now.
Before I push the shock button, I want to make sure you're clear. I'm clear. I visualize everybody's clear. Clear.
The shock delivered. Analyzing heart rhythm. Do not touch the patient.
Nobody touch the victim. It's analyzing. That means no CPR.
Analyzing heart rhythm.
It's still analyzing. Nobody touch them.
No shock advised. It is safe to touch the patient. Check airway. Check breathing. Check pulse. If needed, begin CPR.
So I'm going to follow those prompts. I'm going to open up the airway with a head tilt chin lift, okay? I'm going to look, listen, and feel for any breathing. I'm basically asking that question, has the AED changed anything? And as I look, I'm going to either see chest rise, possibly feel some breathing on my cheek, or I can hear breathing. If I don't feel, hear, or see any breathing, I got to start CPR up. What do I go to? Correct. Compressions. How many? You got it. 30. I'm going to be doing 30 compressions. How many breaths? 2 breaths. Compressions, breaths. When the AED, which is programmed to come on in about 2 minutes, says analyzing, if I'm only at 15, 16, just stop where you're at. Stop where you're at. If you're delivering a breath that says analyzing, finish off the breath. Don't worry about giving a second breath if you only gave one. Let the AED do its job. Once we put these pads on, we're going to follow the voice prompts. We may have to do some CPR like we just demonstrated. And we're not going to take these pads off. Paramedics do have adapters, or they may let the AED play out and do what it's designed to do after it analyzes what's going on with this person's electrical activity. Okay? So we understand. We can't use an AED if we're kneeling in a puddle of water. For you lifeguards out there, we get somebody out of a pool, we got to start CPR, the AED arrives. Guess what? We got to move that person out of that puddle of water. I don't want to be kneeling in a puddle of water. Water is a conductor of electricity, and doing it and working with an AED. So we move them out of that puddle of water and dry them off. Also, remember, when it's analyzing, we said nobody should be touching them. We don't want anybody down here petting a foot, combing his hair, holding a hand. Loved ones want to do that stuff. We have to make sure nobody's touching them because it could pick up their electrical activity and throw the AED machine off, okay? The AED might think, oh, we've got organized electrical activity because he's connected to somebody with organized electrical activity. And then again, when it calls for a shock, you want to make sure you're not touching them. Notice I said you're clear, I'm clear. I visualized around the body. If this guy's arm was reaching out and touching my knee and I pushed the shock button, That could stop my electrical activity. We don't want that to happen. I don't know what it would feel like, okay, if somebody pushed the shock button, but I guarantee it's not going to tickle, okay? So, it's very important when it's analyzing, nobody's touching them. If we have to shock them, we got to make sure everybody's cleared before we push the shock button, okay? If we find somebody with a implanted device, okay, it'll be pretty easy to recognize once we expose somebody's chest. In my experience, most implanted devices, perhaps a pacemaker, are over to the right. I am not a cardiologist. They could be to the left. Wherever they may be implanted, I want you to understand something, okay? Particularly with the upper right. Let's say we have an implanted device, and you'll be able to tell due to scar tissue. Let's say it's on the high side up here, okay? We're not gonna go directly over with the pad, we're gonna go just beneath it, okay? If we have an implanted device down here, again, we don't go right over the pad, we're gonna go just above it, okay? As long as we have pads upper right, lower left, our electrical activity is going this way in our body, starts upper right and goes to lower left, this is fine, okay? If we switched the pads, it's not a big deal. As long as one's on the upper right, lower left, but nobody's gonna tell you you're doing it wrong, because if you put this pad upper right, you'll always be correct, okay? Remember, what's the first thing you do with an AED? Turn it on. That's right. And this concludes our little portion of the AED Part 4 series, okay? We'll be getting back to you real shortly.